Hi, my name is Lauren Lasquadro, and this is my reflection for Nursing 109 and how I would apply a clinical judgment to end-of-life care. In the context of end-of-life care, it's vital for me to engage in continuous assessment of the client's needs to deliver truly comprehensive patient-centered care. This involves close monitoring for any indications of discomfort, evaluating the effectiveness of pain management interventions, and ensuring the emotional, spiritual, and cultural measurements of care and that they're adequately addressed. Actively involving family members and loved ones is also essential in providing holistic support during this time. An ongoing reassessment is crucial to guide and adjust clinical decisions that we make as a team and myself. For example, should pain control prove poor, prompt collaboration with pain management specialists is a must. Also, comfort interventions and strategies aimed at psychosocial and spiritual support must be continually reviewed and adapted to remain aligned with the patient's conditions, values, and care goals. Under recognizing cues, it would involve me noticing and collecting information in the form of subjective and objective data from the patient, the family, and the healthcare environment to inform my nursing decisions. So I would assess for physical cues such as verbal reports of discomfort or nonverbal actions such as facial grimacing. Any emotional cues may be present, such as signs of anxiety, agitation, distress, restlessness by the client. Under analyzing cues, I would evaluate the severity and the impact of the cues on the client's quality of life. Under prioritizing a hypothesis, it will involve me addressing the needs that are most urgent, like uncontrolled physical symptoms, such as pain. This would be my my number one priority. It would take precedence over interventions for emotional and spiritual distress. Of course, they'll be addressed once the pain is managed. An example of this would be to implement non-pharmacological comfort measures such as repositioning, warm blankets, cold compresses or warm blankets, massage, calm environment. I'd administer the prescribed analgesics such as the opioids and evaluate their effectiveness. This may help with some of the emotional distress as well. Providing a calm, supportive presence, I'd sit in silence with the patient when needed, or for spiritual care, such as the chaplain or religious leader, based on the client's beliefs, and offer presence and therapeutic communication. Under generate solution, I would develop a plan of care that may include medication adjustments, consulting with pain management team, and interventions such as the use of communication, therapeutic communication, sit with the patient, validate their fears, and allow them to express their thoughts and emotion. I'd engage in a chaplain or spiritual care provider if the patient desires, and also create a calm, comforting environment such as dimming lights, soft music, involving the family in care, so I'd have them moisten their loved one's lips, hold hands. I'd educate the family members about the signs and stages of the dying process, and of course offer grief support resources and counseling for hospice services. Undertake action based on the patient's verbal reports and nonverbal signs of pain. I'd administer the prescribed opioid and then reassess for comfort 30 minutes later. I'd also adjust the environment to promote calm, dim lighting, minimize the noise. When the patient is expressing fear, I can provide listening presence and arrange for the chaplain to visit. I'd explain to the family what physical changes to expect in the dying process and reassure them that we as a team are focused on their comfort. And they would they would be encouraged to sit bedside with their loved one. Under evaluate outcomes, I'd assess if the pain level is decreased and if the client is more at peace, and of course assess if the family members feel supported. Thank you for listening.